Next topic, politics.
Stuff.
I'm gonna talk about the Trump ABC town hall. Um, it's a little unfortunate that we're recording today as opposed to like tomorrow because I believe tonight actually Joe Biden's having his town hall. So it would have been nice to compare and contrast, but perhaps we'll talk about Biden's in the future episode. Yeah, yeah. So all right, so Trump had his town hall on ABC. What I personally liked about this, and I didn't see it live, right? So I saw lots of clips on YouTube afterwards. But what I personally liked about it is it was one of the few chances we get to see Trump out of his, President Trump, let me give him his due respect, President Trump out of his comfort zone. Because generally he likes to go for interviews with people who tee him up with responses. Fox and Friends are notorious for that. His buddy Sean Hannity, he had a recent interview with Laura Ingraham where he was like touting some conspiracy theory, and she was trying to like pull him back from the brink. And then,
hey, who was that?
Laura Ingraham. And she was like, "Oh, surely you don't mean that." He was like, "Well, the people in the shadows," and like he sounds crazy. Anyway, so same thing with Janine Pirro. You try to tee him up, right? But this is one of those situations that where you get to see the American people, right? Because we've also seen the actors interview with Jonathan Swan, where it's very hilarious, and Trump says a lot of dumb things. But at the end of the day, you're still like, well, it's a journalist and fake news media and yada yada yada. But now,
funny as shit. I don't care what people say.
Right.
He really is. He's hilarious. Without meaning to, a lot of times, he's hilarious.
Yeah, yeah. Sometimes we don't need comedy from our president. We need
no, I mean, don't get me wrong. I don't want the first description of my president to be, oh, he's funny as shit.
Yeah.
But I gotta find the silver lining somewhere.
Right. So the good thing about the ABC town hall is it was an opportunity for Philadelphians who identify as undecided voters to ask him questions. And the one that made the rounds a lot, there were a lot of really good questions, but the one that made the rounds a lot was this one lady who she had basically said that she had pretty much decided that she wasn't going to vote in this election because she's like, I've been voting for, she didn't say this during the question. She said it in a follow-up interview. She said she's been voting for decades and neither party has done anything to change her life. She was born with this pre-existing condition. I forget what the disease is called, but essentially cysts are growing like throughout her like body, and it's like it's moved to her brain. And she said essentially she's gonna die from a stroke one of these days. And she was asking the president about trying to remove the Affordable Care Act, the pre-existing condition coverage in the Affordable Care Act, which covers a lot of people like her who were born with these like terrible afflictions. Did you cut off for a bit?
I disconnected. You're good. Keep talking. Okay, no, you were talking, so you're good.
Okay. Who were born with these terrible afflictions. And she was saying that if you take away the Affordable Care Act, it would give the insurance companies the power to put a cap on her life, which she's already passed by aging out of that. And she said she's done all the right things. She's worked hard. She's got 2 degrees. She's a teacher. All that stuff. What can you do to like promise that you keep coverage of like pre-existing conditions? Anyway, as she was asking this, she said something about Obamacare, and then Trump tried to interrupt, and then she's like, please stop and let me finish, right? She just shut him down and like finished the question. And that was like
shut down the president of the United States.
Yeah, that was like the big moment of it. But
that's crazy.
it's one of those situations where it's like, look, you're no longer in your Fox News bubble. These are the real people who need your help. Like listen to their questions. I saw someone online saying that, well, Obamacare has issues and they should, remove it and replace it. And it's like, yeah, okay, fine. Put your replacements there
You know what else has
first,
issue?
and then remove it.
You know what else has issue?
Mm.
Non-affordable healthcare has a lot of issues too.
Yes, exactly. Like I get that
like,
the Affordable Care Act has so many problems. Put something in place, then remove it. Not remove it and then try to put something in place while people
or build on it. Look, build on it. That's all you gotta do is build on it.
Yeah.
Like, start building on it. Be like, you know what needs to happen with the Affordable Care, the Affordable Care Act is you need to figure out these precedents of these are the things that cannot absolutely in any circumstances be removed. Basically, short of making them constitutional, where you just this or this, you know what I mean? Like these things, like there can no longer be pre-existing conditions can no longer deny you actually having health insurance. Because my question is, I'm like, why do I really need healthcare if I'm perfectly healthy?
Mm.
I need it. I know I need it just in case, right? But I'm saying like all the eliminating people with pre-existing conditions. You're basically saying that this person actually needs it.
Yeah.
So that's the reason I'm denying them. So you're basically saying you're not here for healthcare. You're here to take money, and then if I have to use it, I can use it.
Well, to play devil's advocate, since that's the thing people like doing, someone who sells life insurance, let's say, it's akin to selling you life insurance after you've died. To sell health insurance, they're selling you in case something happens, we'll protect you, but they don't want to sell it to people with pre-existing conditions because like that's something has already happened. But
yeah, but guess what?
They didn't
you still have health because you're still alive.
Yeah. So they'll cover other things.
That devil, that salesman is stupid. Okay, because it's not the same. I'm sorry.
Yeah. So they'll cover other things, but not that, whatever condition is. So, and then this is what they'll do, right? They'll be like, oh, well, this thing that you went to the hospital for, it's a direct result of this condition you have, so we can't cover it. It's very.
That actually reminds me of recently one of my friends. So her husband passed away. So she met him when he had cancer, and she was with him and all that good stuff. It was a great story. She's a beautiful woman, like great heart and all that stuff. And she was with him. He had cancer when they met, went through chemo, right? And then actually one of the things that she mentioned was that when he passed away, all of a sudden is she had to she had to create a GoFundMe, right? Because the life insurance that she had was like he had to basically have lived this many years longer before they paid 100%.
What?
Yeah, I know. So that's just like it's just freaking crazy. Like that's the one thing that they need, that we just need to definitely get rid of. Like there needs to stop being this argument of allowing insurance companies and pharmaceutical companies to basically control the conversation, because that's what they do.
Mm-hmm.
It's like, look, if you want to be in this business, this is what you're going to have to deal with. If you want to be in the insurance business, if you want to be in the healthcare business, you're going to have to understand that, look, in order for you to get healthy people to pay for your stuff, you're also going to have to allow sick people to pay for your stuff, and then pay them, and then do, because guess what? I could be healthy for the next 20 years. I never go to the doctor. I rarely get sick, and obviously looking at me, you could tell I'm a big old bill of perfect health, but I rarely get sick, right? I'm being sarcastic, by the way, people. I'm a little bit overweight, but anyways.
Oh, hence the big O.
So anyways, but I never get sick. I really don't. I rarely get sick. Like, maybe I'll get the sniffles here and there, but I never have to go to the hospital. I never have to call out of work because I'm sick. So I'm paying into my insurance, right? That's just basically me paying into I'm basically paying for the insurance company to take care of sick people who need their services, right? Why do we need to stop allowing